Okay, there we go. All right. Thanks everyone for joining. Today we're talking about how to stay healthy while traveling. My name is Dr. Ravi Gupta, and I am happy to talk to you about this topic. It's a question that we all have, and I'll just start with a story. I was traveling recently to a conference in Salt Lake City, large conference, 1,000 people, and I was hanging out with a good friend, and he and I had a drink before dinner. At dinner, we were talking closely the whole time. We went out afterwards, and we walked home, came back to the hotel, and 2 weeks later, I heard from him, and he mentioned that he had COVID, and he got it pretty severely. It was very symptomatic, felt horrible for a couple weeks. He didn't mention this to me before, but it got me thinking, hey, we were very close to each other. We're hanging out with the same people. Was I exposed? How many asymptomatic people were there at the conference? Who else was sick? Thankfully I didn't get affected, but sometimes, as we all know, we all travel and we get affected with some kind of infection, illness. Could I have done something to prevent that? So I'm going to talk about all those types of things during this. There we go. Sorry, there was a technical error there. I'm going to talk about all those types of things during this webinar. So I hope you can get at least one or two things out of it. If you have your phone handy, use this to take get that QR code app and download this free healthy travel guide that I put together. It's basically a compilation of all the things that we're going to discuss during this talk. And so you don't have to take notes. You can print this out, take it with you while you travel. It'll be a very helpful guide in making sure that you're following some of these principles that I mentioned. So a quick word about me. My name is Dr. Ravi Gupta. I used to work in a large hospital system close to where I live currently, and I worked as an inpatient adult provider, a hospitalist. And what I noticed as a hospitalist was that patients were coming in through a revolving door. And what I mean by that is they come in with exacerbations of their primary illness, their chronic illness. We treat them for that, they get better, and then they come right back with other exacerbations. So my question at that time was, how can I make this process stop? Like, what is the underlying cause of these chronic diseases and these exacerbations? And really what it boils down to are some fundamental things, such as diet, exercise, sleep, nutrition, certain lifestyle behaviors, exposures, allergens, toxins, things of that sort. And when you factor in all those things and you take care of those things, the symptoms, the manifestation of illnesses seem to disappear. And this type of medicine is called functional medicine. It's a type of medicine that I discovered recently, very passionate about, and that's the type of medicine I practice. Also in this picture are my two wonderful kids. You can see here. Okay, let's get started with the presentation. So we all love to travel. We travel to fun places. We see beautiful scenery, gives us a break, something new, way to grow and contribute in different ways. But then we also hate to travel. There's so many untoward consequences like high stress, infection risk, time difference, jet lag, you break good habits, poor food choice, difficulty sleeping, lack of proper exercise, altered bowel habits, recovery after travel becomes an issue. In fact, a lot of us travel, we go on vacations and we come back needing a vacation from our vacation. It happens to all of us. And the question is, how can we travel in such a way that this doesn't happen? Travel in a way that we sleep well, we feel refreshed, and we come back not needing another few days off after a trip. So the goals of this talk are to understand how to travel in a healthy way and feel great upon return. We're going to talk about infection control, exercise, nutrition, sleep. I really want you to take one or two tips away that will make a difference in your travel. And I really want you to come out of your trips feeling refreshed. That's the ultimate goal. Now, if there's one thing that you could do to help yourself while traveling, it is getting a good night's sleep. All the tips and tricks and things like that I'm going to mention to you really boil down to this. It's getting enough rest and the exercise, the diet, the the light exposure and things of that sort that we're going to talk about in just a little bit, all go towards this. If you get sleep, your immune system is actually more robust, and there's good data to support a higher antibody count and better innate immunity when you get good sleep. You don't feel like binging. You don't feel like eating some of that high carb processed type food. You just feel better in general. So that's the one thing. And here's a quick some quick references about sleep that you can look up. Again, this is all in the one pager. You don't have to write this down, but you can go to our website. There's some good podcasts. Andrew Huberman is great, is a great reference. He does a great podcast about sleep. There's multiple podcasts here. The first one is in episode 2. And if you're really interested in getting deep into it, an excellent book is Why We Sleep by Matthew Walker. Okay, so let's move on to infection, and we'll talk about sleep towards the end. Infection, as I mentioned in the beginning of the talk, is super important. The dose of exposure matters. Now, a lot of people think about infection as the robustness of their immune system, and they think, oh, otherwise, I'm young and healthy. I'm okay. I don't need a mask. I don't need, anything other than just, my own body's immune system. Well, the dose of your exposure, or the amount of infectious particles that you're exposed to in your mucous membranes, actually has an effect on whether you're going to get infected or not. So, for example, if you choose to wear a mask and the mask is covering your face and somebody does cough, or there are some, or you have a face shield or something like that, somebody coughs and those droplets hit that face shield, you still may get exposed, but the dose decreases. Versus if you have nothing on and they cough and you get that full exposure in your mucous membranes, you may get infected. So think about that. Think about the strength of your passive barriers. Passive meaning your skin, the face masks you're wearing, or any protective type things. And also, obviously, the strength of your active immunity is important in repelling or taking care of any type of infection. So when we think about infection, we think about exposures. Airborne is the one that we think about mostly, especially with COVID just recently. Recently behind us, it's probably more endemic than pandemic at this point. Food, waterborne illnesses, sick contacts, contaminated surfaces, insect-borne illnesses, or other things. But really, I'm going to focus on airborne infections because that's what we think about more often now. So, big question: mask or not? What is the right answer here? Because you see people wearing masks and you see people not wearing masks all the time. The answer is it depends. And I know many of you don't like that answer because you want a definitive yes or no, but there really is no definitive answer here because it really depends on your circumstances. If you are immunocompromised, if you're older, if you have a chronic disease, if you have other people that are immunocompromised in your circle, those are times when you want to consider wearing a mask. If you are otherwise healthy, your family's healthy around you, they're older, they're not immunocompromised, you can go without wearing a mask. There's no mandate at this point, and the decision's really up to you and how you feel and what your risk tolerance is. The one caveat is if you're sick, if you're coughing, wear a mask because you're protecting other people from getting sick. So it's really not a good idea to be coughing out without wearing some kind of protection there. Now, there are different types of masks. There's the N95 mask you hear about. Those are fit tested. Most healthcare workers wear those types of masks. You don't have access to those typically. And if you do, they're not fitted properly for you. Better ones are the K95 or K94 masks, which are similar. There is a tight fit and they protect you from aerosol and droplet. The simple masks only protect you from droplet, like the common cold and things like that. But when you're talking about COVID, that's droplet and there's some aerosol component too. So if you really want to protect yourself from COVID, wear a tighter fitting mask. If you just want to, protect yourself in general or protect others, wear a simple mask. Personally, I do not wear a mask when I travel in airplanes. And I only wear a mask if I feel like I am sick or I know that other people may be sick around me. And that's my personal choice because I am otherwise healthy. And I know the filtration in airplanes is excellent. The air circulates about every 2 minutes, and there's a HEPA filter in place, and they pull outside air, which is clean. So, at 30,000 feet, there's no infectious particles there into the plane. So I tend not to wear it on planes, but only in certain circumstances. But again, it's your decision whether you want to or not. Passive immunity, we talked about washing hands, hand sanitizer, face masks, all things that you should definitely consider. One point here, when you're using sanitizer, just make sure you apply it for the right amount of time. A lot of people just rub it for a second and think it's done, but make sure you apply it till it's dry and throughout all your hand surface, and wash your hands for 20 seconds. Just a good something to think about if you don't do that already. So how do you improve your innate active immune system? Now we talked about passive immune system. How do you improve that? Well, you're going to hear the same theme over and over. It's sleep, diet, exercise, stress management. Supplements are way down there. They're like tweaks. They're not going to be things that are going to change change aspects tremendously, but they can help. These are the supplements that I would recommend to take just in general, but especially while traveling. A good multivitamin, magnesium glycinate. Magnesium you can take at night. It helps relax you and helps you sleep. The glycinate version is better than magnesium oxalate, which is the cheapest one that you'll see when you go to like Target or CVS or other stores. Try to get the glycinate version or threonate. Magnesium threonate is also good. Omega-3 fatty acids, vitamin D, curcumin, zinc. 2 cups of green tea in the morning. It's very good. Got nutraceuticals, a lot of antioxidants. Melatonin, you can take melatonin at night. It doesn't interfere with your deep sleep. Whereas if you take Ambien or Benadryl or some of these other hypnotics, they interfere with your deep sleep. You don't feel as rested. Alcohol also, you don't feel as rested. You might go to sleep, but you're not going to sleep well. Versus melatonin will help you get to sleep. There's good data that support this, and it doesn't interfere with your sleep cycle. If you go to my Fullscripts dispensary and you email April, I will give you 20% off of any supplement that I listed or anything that you want. You don't have to. Again, you don't have to take supplements. It's not necessity, not a requirement. But if you are interested in it, feel free to do it this way. You can also get it from any other health food store. I would opt to get it from health food stores rather than CVS or Walgreens or something like that. Excuse me, because those stores and the Fullscripts dispensary and other medical pharmaceutical grade dispensaries have better, higher quality products. Also, the supplements I take, Athletic Greens, that's my multivitamin. I take that once a day. Here's a Fullscripts link. And then there's a gummy called OMFG. It has zinc and other nutraceuticals, as well as has mushrooms and different types of mushrooms in there that are helpful for immunity, just for general well-being. They're antioxidants. It's a good compilation of multiple things, and I really like it. So I take those. You're welcome to try that if you'd like. Okay, so stress management. Before I get into stress management, I want to do an exercise with you guys. If you could just stop what you're doing for a second and then take a deep breath. And what I want you to do is take a deep breath for 4 seconds and then hold it and then exhale for 8. So I'm going to count. Okay, ready? Deep breath. 1, 2, 3, 4, and hold it. And exhale for 8. 1, 2, 3, 4, 5, 6, 7, 8. Okay, let's do it again. Deep breath for 4, hold it. 1, 2, 3, 4. Hold it. And then exhale through pursed lips for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Now just see how you feel. This is called a 2x breath. And it's something that you can do that will quickly activate your parasympathetic system. Sort of like a hack. Because if you think about it, excuse me. If you think about it, if you're activated, if you are in a situation where you're in the fight or flight mode, you're not going to take deep breaths. You're not going to calm down. When you're in a state of rest and digest, that's when you take deep breaths. And what you're doing with this deep breathing technique is you're tricking your body to go into the parasympathetic, you're quote unquote tricking your body to go in the parasympathetic state. And this is a great technique to use when there's high stress, you're late to a flight, your bags are missing or whatever it may be, and you're kind of really active. Think about this, do this for just like, maybe 20 seconds, and it really helps calm you and relax you. So the trick here is to balance your parasympathetic and sympathetic, meaning that you really want to be more in the parasympathetic space than the sympathetic space. Parasympathetic is rest and digest. Sympathetic is fight or flight. So a way to think about this is thousands of years ago, when our ancestors were living in the woods, living in open spaces, and there was like a saber-toothed tiger coming at them, they would run and their sympathetic system would activate. But then when they were in a safe space, their parasympathetic would activate and they were completely calm. There was really no in between. It was like all or nothing, one or the other. Just in general, especially compared to now where there's chronic stressors. And even travel is a stress, right? Like going to a different time zone, getting on a plane, high altitude, all that kind of stuff. That's a stressor. So what you want to do is activate more of the parasympathetic. So the way to do that is meditation. And a lot of people, there's many different ways to do that, but this is one of the easiest ways. And a lot of people say meditation, and I know many of you are thinking, I just do not like meditating. It's not something that I do. I don't want to do it. And that's fine. The better way to do it, if you can't do that, is to walk and just be aware of your surroundings. So that's sort of a meditation itself. And what I mean by this is in the morning, early if you can do it, or when you have some time to yourself, go for a walk outside. If you can watch the sunrise, that's even better because that will reset your circadian rhythm, and I'll talk about that in a bit. Go for a walk, look at the scenery, feel the breeze, take some deep breaths, really feel the air in your skin, feel the warmth of the sun, just really experience yourself in that situation. Pay attention to what you're seeing, what you're hearing, what you're smelling, what you're tasting, what you're feeling. And when you do that, you're putting yourself in your parasympathetic space, just, really being present in the moment. And if that's all you do, then that's fine. And that's sort of a meditation, and you're getting your exercise too as you're walking. The other thing you could do is the 2x breath for 5 minutes. I really like using a mantra. And what a mantra is just a repetitive word, and you say it over and over. And the advantage of that is that word will put you in that state when you're active. So my word is swaha. So I say, and that there's a meaning behind that. I think it means peace or something like that. But I say that over and over when I'm meditating. So when I'm in a situation where it's a little stressful, and I say that word and take some deep breaths, I immediately get in that parasympathetic space, and it calms me down. Now, being in this space is also a healing space, less risk of infection. You can sleep better. So it's super important to get there. here's some references. Ziva meditation is a way to teach you how to meditate. Look at that. Newcom, it's a system that uses binaural beats to put you in a meditative state. It's really interesting. It's a little bit expensive, but maybe worth it if that's something you like. Okay, so now let's jump to the meat of the presentation, no pun intended, nutrition. So nutrition is probably the next much more important thing aside from sleep. Eating a high carbohydrate processed diet, high fat and carbs, it makes you feel like crap. It makes you gain weight, and that's why you need a vacation from your vacation most of the time. It's eating these types of foods, and you don't sleep well at night when you eat these types of foods either. The thing about being on vacation is you want to eat this stuff, and what I want to tell you is it's fine. You don't have to not eat this food because you want to enjoy your time there. But what you want to do is be intentional about how you do it. And if you just do these are simple things you could do. It will help you enjoy what you're doing more, and then you also don't feel like crap when you come home. The biggest tip I can give you is to fast before and after you travel. And what I mean by that is, for example, if you have a flight at 12 o'clock, you take your morning coffee without cream, without sugar. And if you want to do bulletproof, that's fine. But you do that in the morning. You don't eat in the airport. You don't eat at the plane. And then you eat at your your first meal is at your destination at that time zone. So if you're traveling, east or west or what have you, whenever it's supposed to be dinner time, eat your first meal at that time zone. What that's going to do is that's going to help you entrain your circadian rhythm. There's a couple things that help entrain your rhythm. It's diet and light exposure, and I'll talk about that in a bit. But that is a simple trick, because what it does is if you do that when you leave and when you depart, it decreases your total caloric burden for the trip. So you can eat a little bit more while you're on the trip and not gain weight. And then when you're eating, think about eating, one cheat meal a day. Maybe consider intermittent fasting. So you eat the first meal at lunch, because breakfast meals are typically, pretty quick and rushed anyway. So maybe skip that. Eat a lunch and then eat a dinner, and then you can indulge a little bit. When you're having your dessert, consider just taking a bite of the desserts. Sometimes a lot of the desserts, you just want that first 1 or 2 bites. You don't want to eat the whole thing necessarily. If you're intentional about it, you'll realize that. So just consider 1 or 2 bites, share it, and that way you can continue to eat whatever you want, but you're not just pushing your calories to the limit and gaining that weight. The one exception is a chai tea latte. So whenever there's a Starbucks, I get a chai tea latte. I'm just kidding. Obviously, this is full crap food. I just love this chai tea. So it's like my vice. I was giving this presentation several weeks ago, and I said the same thing, and then somebody came up to me and was like, how do you recommend to order the chai tea? What do you put in there? And I was like, I was totally kidding. This is not real. You shouldn't drink this, but it's my vice. I drink it when I travel. People that travel with me know this. Okay, so other travel nutrition tips. I mentioned eating at the time of your destination. Pack healthy snacks. It's okay to indulge. We discussed this. We talked about intermittent fasting. And here are some references. If you want to do a deep dive into intermittent fasting, I gave an intermittent fasting webinar. Just log on to our website. Also, there is a protocol that I put together called the Body Transformation Protocol, which teaches you exactly how much you should eat at any given time, and you get a sense of what you can eat and what you shouldn't eat. It's really helpful, and there's a really good book called Bigger, Leaner, Stronger by Mike Matthews, another good book to read about diet and exercise. Take a picture of this. These are some examples of on-the-go snacks to keep handy. I always carry some nuts with me, protein powder when I travel, some good healthy power bars and some fruit. I mean, these are simple things you can travel with, and you don't eat the airplane food or other things like that. So water filtration, I absolutely recommend getting a water filter and traveling with it and filtering your water where you go. For one, I hate wasting all that plastic when you travel, but also that water in those plastic containers has microplastics in there. It's oftentimes it's just municipal water in there anyway. It's cleaner to filter your water. You have to get a good water filtration system. I use a zero water filter. It's great. The problem with traveling with that, though, is that they will invariably stop you because they're, I guess it looks like it's a bomb or something. They always want to check it. So they will stop you. So I always put it in a separate bag. They stop, they check the filter. It takes like an extra couple minutes most of the time. So if you're okay spending the extra time, I definitely would take this water filter. It makes a lot of sense, and you can stock up in your apartment or hotel and fill up your water bottles. Just a quick aside, I was at another conference in Vegas recently, and I saw these Fiji water bottles at the hotel, and I was like, oh, I thought this was part of part of the room, and I was drinking them the whole time. I didn't have my filter with me. And then when I was checking out, I saw these $25 charges like throughout my bill, and I was like, what is this? These charges? And I looked, it was the water. They were charging me $25 per like 16 or 24 ounce bottle of water. It was insane. So it was like a good reminder for me. I'm never doing this again. I am going to bring my filter with me wherever I go. I suggest you do that. All right. So now we're going to jump to movement or exercise. So there's a lot of benefits to movement. Improve insulin sensitivity, increase BDNF or brain-derived neurotrophic factor. It's like kind of feel-good hormone. Improve your mood, increase muscle mass, decrease chance of injury. There's long-term benefits, cholesterol, et cetera. Improve your sleep, as I mentioned. But the thing to remember, and this was a huge thing for me, and this is something that I think many of you will really, like a tip that you really will get something out of is, as long as you're not at bed rest and are walking and otherwise active, it takes about 2 weeks of no exercise before any significant decline in muscle mass or strength. So I used to be hyper vigilant about finding a gym and lifting weights during travel. And I would, in fact, go to the lengths of, if the hotel didn't have a gym, I'd look for a gym outside and go there to exercise. When I realized this, I changed the way I would exercise when traveling to exercising in my room only and exercising just 20 minutes a day. It cut down on my exercise time. It was easier for me. I enjoyed it more. And it's something that anybody can do while they're traveling. So I'll give you some links. Did I give you those links? No, it's on the next slide. I'll give you those links in just a little bit. Also, protein is important to maintain your muscle mass. So when you're traveling, just make sure your plate is, the standard is vegetables and, fist size of protein with a meal. But if you don't have access to that kind of food all the time, you can take this type of protein supplement. A really good high quality one is this metagenetics one that I take. You can get it on the website that I mentioned earlier. So examples of things to do on the go, long walks. You can bring exercise bands with you. There's something called the X3 bar. That's helpful. It's a little bit expensive, but you can get much cheaper bands on Amazon. You can use those when you travel. Something called Tabata, really easy type of high intensity interval training exercise. Think about NEAT activities or non-exercise activity thermogenesis. What that means is exercises it's not really exercise, but it's movement and doing a little bit more, like taking the stairs instead of the escalator, or parking further away and walking to your destination. These are small little things, but they will make a difference over time. Here's some references. That's the X3 bar that I was mentioning. This one woman, Heather Robertson, she's got great Tabata workouts. You just Google her and you can do those in your room. Very easy. Okay, so now we get to sleep and circadian rhythm. So I mentioned the two big factors that play in your sleep are light exposure and meal timing. All right, so this is really how you can get the best sleep, aside for all the other things that I mentioned. These are the things you could do to really get that rest that you need. First thing is light exposure. So you want to get exposure to the sunlight for 4 to 10 minutes in the morning. Now that means outside, because when you're indoors, a lot of these windows are low E windows. They block the light and infrared, and you don't get as much exposure. So you want to go outside. You don't want to look obviously directly at the sun. You don't want it to be, you don't want to, when you're blinking and it hurts, don't do it. You want to make sure you're outside, but not looking at the sun. But you want to get that exposure for 4 to 10 minutes. What that does is suppress your melatonin. It resets your circadian rhythm at the time zone where you are at. You also want to get sun exposure in the evening. That means when the sun sets, you're outside. And what that does actually is it sort of fatigues your photosensors so that they're not as responsive to light afterwards. So if you do have indoor light afterwards, it's not as responsive. It's not going to suppress your melatonin. You're still going to have that melatonin surge prior to sleep, and you will sleep better. So those are two simple tricks to do. And it depends, depending on which time zone you are in, you can do that and it'll entrain your clock. I'll talk more about tricks to entrain your clock in a bit. If you exercise in the morning, make sure you continue to exercise in the morning. That helps entrain it. Eat according to the time zone you're at. Also minimize alcohol exposure prior to sleep. If you want to drink, it's better to drink during the day and allow that alcohol to wear off prior to going to sleep. No caffeine after 12 p.m. So if you want caffeine, do it before that time. Otherwise, it's going to affect your sleep. Make sure you meditate, journal, find something that gets those thoughts out of your head. You write them down. Take a warm bath. What a warm bath does is it dilates your peripheral circulation. So you're radiating a little more heat, and then when you sleep, you're actually going to radiate more heat, and then you'll cool down more quickly. So it's a bit of it's a bit counterintuitive. A warm shower will actually help you cool down, whereas a cold shower will help you warm up later. And you may notice that when you take a cold shower, you're freezing, but you feel kind of warm afterwards. So that's how that works. Also, a trick, if you're a hot sleeper, which I am, and for many months, I would wake up and I'm like, oh, it's so hot, and I like the sheets on me at first when I'm going to bed, but in the middle of the night, I was wake up, it's so hot, and I'm like, how do I stop this? A trick is your periphery, your hands and your feet radiate a lot of heat at night. So if you expose your feet at night in your hands, it'll decrease that heat and you won't feel as hot. And actually, I just did this simple thing and that worked. I also got one of those cool sleepers where it like runs water under your mattress and it helps you stay cool. And that didn't do anything. But just exposing my feet actually did more than anything else. So sometimes it's the simple things that make a difference. Make sure you block all ambient light, especially during 11 p.m. to 3 a.m. because that's the time where your photosensors are more sensitive to light. You want to make sure that all light is blocked. Okay, so this is a trick on how to reset your clock. So traveling west is fine. Typically, most people would do fine with that. You can just sort of travel west and you can stay up later. You'll end up sleeping later. You'll get into the rhythm once you see the morning sun and that type of thing. If you're traveling east, the best way to reset your clock. Now, actually, let me step back. if you're only going for two or 3 days, try to stay on your same time zone. You don't have to change it. Just try to, wear sunglasses in the evening, so you're not exposed to too much light in the evening, and wake up same time you typically wake up, and try to expose yourself to light. Whether it be there's some devices you can buy that simulate sunlight, and you could look at it for 4 minutes or so, and it resets your clock, or like a screen or something like that's bright. Stay on your same time zone. If you're going for longer than that, you want to reset your clock, and the way you do that is you wake up about 2 hours before you normally wake up, and expose yourself to light, to very bright light. And what that does, it suppresses your melatonin, it resets your rhythm, and go to bed 2 hours before you normally would go to bed. And do that for 1 or 2 days. What that'll do is that will kick you back a couple hours, and you can probably, your body can accommodate a couple hours at a time without any issue. And then when you travel and you get to that time zone, it'll be so much easier, and you'll feel so much better rested than having to do it all at once. So that's a quick way to train your biologic clock when you travel east. Okay, so for some sleep tools and supplements, eye masks, earplugs, noise canceling headphones I mentioned before, a white noise app. They're free. You download them. There's a lot of noise in the background. You put this on, and you can sleep better that way. Magnesium glycinate I mentioned, melatonin I mentioned. Simple teas like chamomile or lemon balm tea helps. There's something called sleepy time tea. You just get it, make one before you go to bed. It's great. There's a nice sleep aid that I found. It's Da Vinci Labs. It has melatonin and other amino acids in there that will help you relax and fall asleep. It's helpful if you want to try that. Also, those gummies that I mentioned, they have a sleep gummy that has some of the same stuff. Also helpful. Okay, well, I hope this has helped you, given you some tips and tricks on how to stay healthy while you travel and you come back happy instead of feeling like you need another vacation. If you want to learn more about what we do, please go to peakwellnesshealth.com and learn about our body reset program. This is an all-in-one program. It's 10 days. It's very simple. It teaches you all the habits you need to live a happy, healthy life, and to really tackle chronic disease and prevent chronic disease in just one 10-day program. And it's really life-changing. So check it out. And here is the link to the guide if you didn't click on that already. And that is it. So I hope you all got a lot out of this. And let me see if anybody has any questions. If you have any questions, please put them in the chat box and I'll answer them for you now. All right. Looks like we do not have any questions, so that's great. Thank you so much, everyone, and I will see you next time.